Hello there, my name is Brendan and this is the first video I'm doing for the Enthusiastic Pharmacist. So the purpose of this video is to talk about the actual BNF. So we're going to be talking about the BNF for the purpose of the pre-registration assessment. Now a lot of people refer to the pre-registration assessment as the pre-reg exam. So in this video, if I ever mention the term pre-reg exam, you know I'm referring to the actual pre-registration assessment. So I'm going to talk about my experience of using the BNF and a lot of the hints and tips that were given to me and ones I've come across that I used to actually pass the assessment. So when you're using the BNF, you're going to be using it for the open book assessment. I've got a couple of initial tips to talk about is annotating the BNF. So you'll hear this term used, and if you look up the GPHC syllabus and guidelines of the pre-registration year, on the GPHC website, they'll refer to annotating the BNF. Now, you need to look up the exact terminology that is used, but as long as what you annotate, what you write in, refers to the text or complements the text that's there, it's fine. So in other words, you can't sit down and write a massive essay, but you can write down a couple of points that refer to the condition or the medications that you're talking about. So the first tip I have is that you should definitely, this edition is the one in September. The actual edition I used for the autumn assessment was 67, so it's 69. And obviously the edition that you guys are going to be using is 69. Now this is a brand new edition, I haven't done anything with it yet. So the first off, so I'm going to be basically discussing between the two of these to show you the different sections I've tagged and so forth. So the first point, you should tag the chapters 1 to 15. That should be straight off. The reason you should tag them is it's just very easy to find information. I mean, if you're talking about say the asthma or COPD tables, you can just flick to that section and there they are straight off. Okay, the next thing you should do is you should definitely tag the interactions A to Z, and you should tag the index A to Z as well. The reasons for this are quite evident that in the exam you're asked questions and interactions. It's very easy to find it, and if you come across drugs you don't know, having the index there and being able to go through that way is very good. So I've talked about the chapters, index, interactions, cautionary and advisory labels. That's another important section in the appendices to tag, because quite often you're asked ones for different drugs. So if you're in the exam and you're unsure, you can literally flick to it and find the information very fast. As part of the blog post, you'll see I've done one on tables. So I've gone through, I think it's 15 tables in total that I would recommend that you tag to find the information fast. Now, for the purpose of this video, I'm not going to go through each of the tables I would recommend that you tag, but for example, you can see the BNF that I use in the exam. You can see that I've tagged all of the tables on the top part here. So, say for example, the first table I tagged was in the palliative care section, and it was on opioids. So the equivalent doses of opioid analgesia, so forth. So use the blog post, go through, tag the different ones. If there's other ones you feel you need to tag, please fire ahead and do it, okay? So the next point I want to talk about is therapeutically monitored drugs. So things like warfarin, digoxin, so forth. So it's good to, not necessarily to tag these sections, but to know where they are, and also to annotate some information. So for the assessment, I annotated bits on each of the therapeutic monitored drugs. I also annotated bits on insulins. So it's very important to put that information in, because it will help you on the day of the assessment. So another tip you can do, and some people might mention to you, is to colour the side of the BNF. So if you look at this BNF along the side here, you'll see different colours for every 100 pages. So if you look up a drug in the index, and you know it's 200 and something, you literally go to your second colour, you're on page 200, so then you can quickly find the drug that you're looking for. Another point to put in is about the index. So I'll just go to the index in my current BNF, and we'll go to, say, section A. So what I did with this one was, there's 2 points that I'd like to talk about this one. So the first one is the enzyme inducers and inhibitors. So it's a good idea to get your BNF and to highlight enzyme inducers and enzyme inhibitors in 2 different colours. So the reason you do this is that when you go through the whole index, say the drug, you want to know if allopurinol is an enzyme inducer or an enzyme inhibitor, you can quickly see by looking at it that without any writing or anything, just a highlighter, that you know the allopurinol is an enzyme inhibitor. So that will basically save you a lot of time in the exam if a question and interaction comes up Very, very useful. Another thing that I found useful was that while you're in each section, so say under the index A, anytime the letter changes, so it's a B, a C, a D, you put a little green or different coloured highlighter mark under each time it changes. That way in the exam it's quite easy to find the information. Now, a lot of people will tell you don't highlight too much because you don't want to highlight everything because then you won't be able to find anything. My argument for that is in the assessment you are not allowed a highlighter. You are only allowed a pencil, an eraser, and a sharpener, and that's it. So you've no highlighter. So if you come across a blank page, and it's quite, as you can see from the BNF, it's quite hard to find information sometimes because the writing's so small, and if it's a page in the BNF you're not familiar with, it takes a bit of time to find the information. So definitely for the index, I'd recommend that. What's the next bit then? I've talked about underlining. Multiple prescription charges. So I think actually if we go back one second, with therapeutic monitor drugs, if you look at the blog post and you look under it's note 1 about annotating the different sections, I've actually put in what the GPHC state about annotating. So the next point I want to talk about briefly though is multiple prescription charges. So it's quite useful in the assessment to have it already in your BNF, how many charges there are for specific items. Now if you have any problems with trying to find out what drug charges or what items imply multiple prescription charges, see my note number 2, and I have a link there to the PSNC website, which is absolutely brilliant for the exam. Definitely go on there and look at the resources they have and the information they have. It's brilliant. So, and that's a link basically to the table, the most recent table they have on multiple prescription charges. What the last point then I have is to talk about the blue boxes and the different warnings for specific drugs. So it's very, very important to be familiar with them. Generally with the assessment, it's chapters 1 to 6 that you have to know quite well. And with the later chapters, they are specialist chapters, but they can of course ask you questions on it, but it's not necessary to go over every single blue box, but more so the common ones. But again, the more familiar you are with the BNF, the better it is. I'm briefly going to talk about the CBNF. So if you've done all your tagging and your labelling with the main BNF that you're going to use in the exam, so the 69th one, and then you have your CBNF, you'll have to do an awful lot less tagging with this one. So let's just go through what sections I tagged, just to give you a brief insight. So I tagged the chapters 1 to 15 again. I also tagged the index A to Z. Now some people prefer not to use these tags, but prefer to actually cut out the different bits. So you can do that. I didn't, because I just found it easier to have the tags hanging out of the BNF. It was easier to find information. So tag those 2 bits. Then I tagged a couple of drugs. I tagged paracetamol, I tagged ibuprofen, and I tagged, it was kind of a strange one, I think because it came up in a sample question once. It was a corticosteroid, so equivalent anti-inflammatory doses of corticosteroids. So I mean, whatever sections you feel that you need to tag that will save you time in the exam, definitely do it. So just to basically summarize this, I mean, it's all very well getting all these tips from different people, and people have done the assessment before and so forth, but your main protocol is your pre-reg tutor. So talk to your pre-reg tutor actually about the BNF and using it in the assessment. And also the second protocol is the actual GPHC syllabus. So my one piece of advice that you should take home from this is that the first thing you should do, if you haven't done it already, is to either print out the GPHC syllabus for your assessment and stick it on your wall. This is what I did. And every time I covered a section, I essentially highlighted it and ticked it off. So then when it came down to the actual assessment, I knew that I'd covered all the topics because everything was ticked. If it comes down to the assessment and you haven't ticked everything, you're not prepared for the assessment. You're not prepared for the exam. So it's very, very important to do that. And also, I mean, you can get all these fantastic pieces of advice off different people, but if you don't put them into practice and you don't get the practice using the BNF, then I'm afraid it's going to be very difficult for you in the exam. So it's very, very important to get familiar with the BNF. So if you haven't done so already, start annotating your BNF, start carrying with you at work the whole time, be it if you're in community pharmacy or you're up in the wards in hospital, and start to use it, because I know that the BNF, there isn't much difference between each edition, but this is going to be the edition that you actually take into the assessment, so do use it. Okay, so hopefully you found this video useful. If you did, please subscribe, and also check out the website theenthusiasticpharmacist.com, and let me know what you think of it. Okay, so thanks very much.